Hello, this is Professor Wheeler. We're going to talk about various aspects of human sexuality, including the psychopathology of the different, what we call paraphilic disorders, and then also some of the just kind of regular sexual dysfunctions that happen, um, and a little bit about their treatment. You're, as a registered nurse, your role is to kind of know in general what kind of treatments are performed and to know some basics of the pathologies because you will deal with those. You're not expected to be an expert in these techniques, of course, but when you're making a referral or talking, educating patients about it, it's important that you know what you're talking about. All right, so our required reading, Halter, Chapter 20, the story from Yalom, In Search of the Dreamer, and then in DK, page 154 to 165. Our objectives, number one, what are some normal sexual developments a person should accomplish from birth through age 12? Number two, list the main sexual issues facing adolescents. Number three, what are some sexual issues in young adulthood? And what about middle age from 40 to 65? List the 8 paraphilic disorders and give a definition of each. Why do people with these disorders seek treatment? Number 5, describe each phase of the sexual response cycle. Number 6, list the 8 types of sexual dysfunction and where they fit in the sexual response cycle. Number 7, what are some biological factors that may predispose someone to an orgasmic disorder? Learning objectives continued. I'm sorry if it skipped some numbers here, but I took a few of them out. But anyway, number 8, what are some psychosocial factors that may predispose someone to a sexual dysfunction? What might be some treatment modalities for the different sexual disorders? Number 10, define gender dysphoria. Number 11, what are some treatment issues for children with gender dysphoria? Number 12, what are some treatment issues for adolescents and adults with gender dysphoria? Number 13, what kinds of challenges does one face when coming out as homosexual or bisexual? And then lastly, number 14, what is the Kinsey scale? So we'll review these at the end of the lecture, but it's good to have an idea of what we're trying to accomplish here. All right, so sexuality is a basic human need and an innate part of the total personality. It's part of wellness. It's part of a good life. Some of you probably remember from the first week of the class that Freud believed that almost all of our motivations come from sexual and aggressive impulses. Um, and it makes sense as a species that reproduces sexually that, you know, one of the reasons why our species has succeeded is because of a strong background in sexuality. So basically, it affects all parts of our life. Although, like I said at the start, you don't need to know like a sex therapist would know, but you need to be able to communicate to patients and know what you're referring them to if you do need to refer them out. If they have those kind of issues that you can, not that you're gonna do the treatment yourself, but you need to know what you can educate them about. Okay, so this is kind of what we're all looking for here, walking off with a loved one on a sunset on a nice beach. At least that's what most of us are looking for. All right, so human sexuality development. So birth through age 12. By age 2 to 2.5, most children know their gender. This has changed a little bit from how we originally thought of it in the last 10 years or so. There's a shift in the culture where it's actually acceptable to revisit the idea of what your gender is at the start of adolescence. And so, we've seen an emergence of a lot of kids coming into the hospital with this because it does cause turbulence in your life when you come out like this. But it's become more acceptable, and it's like just another one of the choices you make when you're deciding who you're going to be as an adolescent. So what's normal, by age 4 or 5, they engage in the kind of heterosexual exploratory sex play. I give the example of playing doctor here. That's a common one in our culture, where they're just kind of examining each other. In late childhood and pre-adolescence may be characterized by heterosexual or homosexual play. What happens with kids that are about to start adolescence is, they've gone through that latency period where their sexuality is somewhat sleeping a little bit from age 6 to 12. And at the end of that, they're starting to have sexual feelings, and they're wanting to kind of be in the role of a sexual partner. And so they'll experiment with the people that are close to them in their life. And a lot of times that's people of the same gender, because that's who all their relationships are. And so if your child, if you discover they've experimented sexually with their friend, it doesn't mean they're going to be necessarily be homosexual when they reach adolescence. It just means that's kind of who's in their life right now. Okay, and then age 10 to 12, it's normal to start, your body's changing dramatically and getting interest in the opposite gender if you're heterosexual. In adolescence, all of the turbulence of adolescence, some related issues, dealing with these powerful sexual feelings. What types of sexual behavior do you want to participate in? How to recognize love? What is when you start to have that kind of feeling where you're bonding with someone? And then unwanted pregnancy. Unwanted pregnancies can really derail the life of a young person. In adulthood, choosing your marital partner, or if you're not getting married, having a long-term relationship with another person. And then parts of adulthood, extramarital sex is a common thing that happens, and it's one of those things where a regular person in a love triangle, you can see somebody become homicidal that would never be homicidal in their life, but it's so painful when you're the person that you're think you have an exclusive relationship with, when it turns out you don't. And especially if they're leaving you for another person, that's some of the times when a person that would never be homicidal sometimes is homicidal, and those can end up in tragedy sometimes. All right, and then we have sex in the single person, so that kind of varies. And these two are not mutually exclusive. Some enjoy the freedom and independence of being single, and then other people are really lonely and don't want to be single. And like I said, it's not mutually exclusive. Sometimes single people, they one moment they feel the one way, one moment they feel really lonely. Then in adulthood, the middle years, 40 to 65, generally a decrease in sexual activity, but we're still very sexual in this age group for most of us. And just speaking for men, sometimes in these years we can accomplish a lot more because we're not so distracted by a high sex drive that we had when we were younger. Yeah, I'm not going to say anything more about that. All right, paraphilic disorders. And these are repetitive or preferred sexual fantasies or behaviors that involve either preference for a non-human object, and we also include parts of the human body that are not usually considered erotic, like a real common one is the feet, and then sexual activity with where there's you're either giving pain to someone else or receiving pain yourself, or humiliation, or some kind of activity with non-consenting partners. So we'll clarify that on this next slide. All right, so types of the paraphilic disorders. Exhibitionistic disorder. And so this is, you'll hear people say, oh, I'm an exhibitionist. That's why I'm a stripper or, whatever. But that doesn't classify as an exhibitionistic disorder. To qualify as having an exhibitionistic disorder, you have to be showing your body to someone that's not looking to see it. And so this is somebody that's like a flasher, but their sexual excitement comes from showing their body to someone that that isn't prepared to see it. It hasn't come to see it, and usually doesn't really want to see it. And then fetishistic disorder, like I said, it's either a focus on non-living objects or parts of the body that are not considered erotic, like probably the famous one is the feet. Frauderistic disorder, this is someone that gets sexual excitement from rubbing against people on like a crowded subway or a crowded BART train, and they try to make it seem incidental, but it's not, and that gets people in a lot of trouble with the law sometimes. Pedophilia disorder, so people that try to have sex with children. Sexual masochism disorder, people that need pain to get excited, and then we have their partners here, hopefully. And I say hopefully because it's better if these people find each other so they're not hurting other people. So sexual sadism disorder, where people want to hurt people to get sexually excited. Transvestic disorder, where someone gets sexually excited by dressing in the clothing of a gender that they're not. And so this is very different than a transgender person. I'll just give an example. The most common is probably men that cross-dress as women. People with transvestic disorder don't feel like they're actually women and they're trying to be true to themselves like transgender females do. Men with transvestic disorder get sexually excited by dressing like women, and so that's very different. So don't confuse those. Voyeuristic disorder, this is people that either the classic, if you ever heard the term a peeping Tom, that's what that's referring to. That's somebody that wants to watch people getting undressed or in a sexual situation where they don't know they're being watched. So the sexual excitement for the person with the voyeuristic disorder isn't really seeing the naked body. It's seeing something that they're not supposed to see. There's I remember there was somebody that had hospitalized that had an arrest for peeking in women's windows while they're dressing or trying to catch them dressing. And he lived 2 blocks from a nude beach over by Muir Beach. But he had no interest in actually seeing naked people that were out walking around naked. He wanted to see the private moments. And so, again, it's not just that they want to see naked people. That's very easy to see naked people. They're all over the internet. They're all over, there's beaches where people walk around like that. But this person with this disorder, they want to see things that people don't want to have seen. So sexual dysfunctions, they usually occur in one phase of the sexual response cycle. This cycle was created by Masters and Johnson in their treatment of sexual dysfunctions in the late 60s and early 70s. They did a lot of research that up until then was kind of taboo in the culture. And so you have the first phase here, desire. So some people, if you have somebody with a problem in phase one, the desire part of the sexual response cycle, they just don't have any desire to pursue sexual situations or or have sex with their partner. They might be able to get excited if they're engaged with a partner, but they don't have any desire to pursue it. They don't, and it's not really, but it's not really appealing to them. Phase two, excitement. This is the part where erectile dysfunction for men and lubrication type of issues for women. That's where those emerge. And then orgasm for men, where either they have their orgasm comes too fast, like in premature ejaculation, or actually the official term these days is early ejaculation, or they have late ejaculation, or delayed ejaculation is the official term these days. They used to call it retarded ejaculation, but nobody wants to think of their sexuality as retarded. So it's good that they changed that. For women, the problems in phase three can be more complicated because the females kind of go through this cycle. Men and women do it the same. It's just men go through it a lot faster, and so it's important to that a couple knows to bring the woman along. And I'm going to talk about that a little bit more later on. But both sexes go through these same phases. All right, so concurrent with the changes in the 60s and 70s, like I said, it was a time when the sexual mores were changed from the 50s, when everything was very conservative, to things were much more liberal and less repressive. All right, so types of sexual dysfunction. We have erectile disorder. It's really made very famous because there's pharmacy companies that put a ton of money into their products and advertising those products. And then female orgasmic disorder, delayed ejaculation, early ejaculation, female interest arousal disorder, male hypoactive sexual desire disorder, genitopelvic pain penetration disorder. And I'm going to define these later on, but that, in case you're wondering what that is, that's a female that they might have the desire and they might have even the excitement where their lubrication is fine and all of that, but it still hurts. And that can be physical issues, or it can also be psychological issues. And then medication-induced sexual dysfunction, which is usually alcohol related or drug related somehow. All right, so biological factors of sexual desire disorders. So in men, decreased testosterone as you get older, and probably the same with women with estrogen, and then elevated levels of serum prolactin in men and women, and then medications that we get on sometimes when we're older, for especially beta blockers for hypertension. When you kind of reduce the blood pressure in the whole body, you reduce it in the areas where sometimes you don't want to have it reduced. So what beta blockers do is they make it where it's hard to get excited about anything. So that's kind of how it keeps your blood pressure down. But in a sexual situation, you kind of want that upregulation of your system. And then SSRIs, they have the famous side effect of making it hard to reach orgasm and kind of lowering the sex drive. And like I've said before, they're so reliable in lowering the sex drive as a side effect that sometimes they're used for people that kind of need that have their their sex drive is too high. And usually we see that it's mainly adolescent boys that have that issue. Then alcohol kind of deadens your nerves everywhere if you're a real serious alcoholic. All right, sexual arousal disorders. So these are biological factors. And so what we mean with sexual arousal disorders is, again, the person has a desire, they just can't get excited. And so this would go on the excitement level of the human sexual response cycle. And like we said, the same with medications. The blood pressure meds that kind of lower your desire, they also make it more difficult to get sexually excited in the excitement phase, not just the desire phase, but the excitement as well. And then medical conditions, anything with your nervous system can affect it. And like I said earlier, chronic alcohol use and medicate. There's a lot of different medications that can affect it. All right, so problems with orgasm, again, SSRIs are a big one, along with beta blockers. And then medical conditions where you're depressed, and with diabetes, remember with diabetes, what it does is it without going into the physiology of diabetes, it kind of thickens things around your nerves, so it makes you less sensitive. The same things that cause the same blood vessel issues that cause neuropathy in your feet can make your genitalia less sensitive. So it makes your penis less sensitive, makes your vagina and your clitoris less sensitive. So in men, any kind of surgery of the GU tract, the genitourinary tract, and then circumcision, the glands of the penis that are cut off during circumcision, that has a purpose, and what it does is it makes it where the penis is more sensitive. And so with that gone, what happens over years and years if you're circumcised is that skin of the penis that is supposed to be kind of internal, it gets a little thicker, which is a natural thing. If you have something exposed that's supposed to be internal, it thickens, and so that can create delayed ejaculation. All right, and then we have early ejaculation. It can be infections, it can be some neurological disorders, psychosocial factors, having come from a religion that causes you to feel very guilty about your sexual thoughts and feelings, any kind of negative sexual experiences, past sexual abuse, and then just the regular problems of life, financial problems, family, job problems, fear of pregnancy, especially if you're from a culture that discourages you from using birth control, chronic stress, anxiety, or depression, not really knowing who you are sexually, so having a sexual identity conflict or a gender identity conflict, relationship difficulties. One of the things that when I worked as a marriage counselor that I saw kill sexual feelings was resentment. People sometimes they even have a strong sexual desire, but they don't want to express it with their partner because of the anger that they have toward them. All right. And then aging related concerns, being self-conscious, especially, well, mostly with women have this issue, but men as well, but, not feeling as attractive as you get older. It really helps us to feel attractive, to have a healthy sense of wanting to have sex with someone and share our sexuality with someone if we feel good about how we look. One of the good things about these days is, the fitness industry and the nutrition industry. It's all there. If people get older and they're not feeling sexually attractive, you can change that. It's a lot easier. The knowledge is out there, and just with a little work, you can change all that. All right. So some of the outcomes that we're hoping for is that you can kind of see what's going on. So connect the situations that are having an effect on our sexual desire and do something about them. Communicate with your partner. You know, be able to verbalize ways. So some sometimes women have trouble doing this, kind of asking for what they want in the bedroom, and then evaluate it realistically. And if they do have kind of variant behaviors, to connect it with what's going on. Being able to verbalize any concerns they have. And then if they have variant sexual behavior, they've kind of thrown all the outcomes into the to a big pot here, but variant behavior like the paraphilic disorders, one of our challenges with them is they usually have to get in trouble before they have any motivation, any kind of strong motivation to change their those behaviors that are problematic. All right. All right. So planning, I don't know, I'm not going to read the slide, but it's important to be really clear what the person wants to achieve from therapy. So with the human sexual response cycle, what's normal and what's not, and teaching the family about this kind of thing. Providing appropriate referrals. So one thing I'll say here is, a lot of you know that my first career before I became an RN was I was a marriage and family therapist, and I did a lot of couples therapy because the private practice I worked in, the director, she didn't like that kind of work, so she gave me most of the couples and the adolescents and the families and the kids. And so I got a lot of that kind of experience. She kind of kept all the divorced women like her. She liked that kind of client. But anyway, it's important if you're making a referral that that you try to make sure if you know that you're making a referral, I'm just kind of looking into your future. Those of you that are into case management, if you have patients that need kind of sex therapy, they need to go to couple counseling, and they need a couple counselor that knows about these kind of issues. The real license, if you don't know anything else about the people that are on your referral list that you're allowed to make referrals to, if you don't know anything else, one thing to know is a marriage and family therapist, they've, all of the marriage and family therapists have had a course in sex counseling, and, that includes the different sex therapy and the techniques and all of that kind of thing. And so that's the one psychotherapy license that you don't get that license without that kind of knowledge. So that's one thing to know. It doesn't mean the other therapy license, like a psychologist or a licensed clinical social worker, they can get that kind of training. It doesn't mean they don't know it. It just means it's not necessarily implied by their license.